everyone, welcome or welcome back to the channel. That is AMS MBBS lectures. In today's session, we're going to continue enteric fever from CVS Microbiology. And in this session, we're going to discuss Widal test, a very important test with respect to enteric fever. So right now, we're going to describe Widal test. In the previous parts, we have already covered the following topics, that is classification, nomenclature with antigenic structure in part 1. Part 2 had the details of pathogenesis, clinical manifestations, and epidemiology, and lab diagnosis is also covered. And right now we're going to cover up the topic that is Widal test. ठीक है? So Widal test में क्या होता है guys? Widal test is done usually by the second or third week of illness. Okay, in the lab diagnosis वाला video you know this thing already. And Widal test is an example of a tube agglutination test over here, guys. Okay, tube because test tubes are used, and over here it's an antigen antibody reaction, guys. So therefore it's a tube agglutination test which is helpful in detecting the antibodies in the patient's serum against the antigens of the Salmonella typhi and Salmonella paratyphi. ठीक है, तो बेसिकली क्या होता है इसमें, आई विल एक्सप्लेन द नेक्स्ट स्लाइड, बट फॉर द टाइम बिंग जस्ट रिमेंबर दैट इज दिस टेस्ट ओवर हियर इज यूज्ड फॉर द डिटेक्शन ऑफ antibodies. ठीक है, and it is an example of tube agglutination test done on the second or third week of illness. For this test we require antigens. Okay, the antigens are required, guys. Okay, so which all antigens are required? Over here we are requiring, see, Salmonella is antigenically complex. We know that Salmonella is having three important antigens into it. Three antigens होते हैं in Salmonella. There are three important antigens. That is the O antigen or the somatic antigen. We have the H antigen or the flagellar antigen, and we also have the VI or the capsular polysaccharide antigen. Okay, and in Widal test we are only using the O and the H antigen. That is the somatic antigen, and the flagellar antigen is that we're going to use. Okay, so Salmonella typhi ka we are using the O antigen of Salmonella typhi, and it is abbreviated as TO, guys. Okay, so pay attention over here. That is O antigen of Salmonella typhi, therefore the name TO, that is O antigen of Salmonella typhi. Next thing we are using the H antigens. Okay, तीन जगह पे H antigens use होने वाले. H antigen of Salmonella typhi, H antigen of Salmonella paratyphi A, and the H antigen of Salmonella paratyphi A, and therefore the name TH, AH and BH. Clear? Now why are we not using the O antigen of paratyphi? Paratyphi का O antigen क्यों नहीं use करना है? Why are we not using the O antigens of the paratyphi? Why this is not used? Because of cross reactivity. Okay, because of cross reactivity we are not using. Why? Because it is the O antigen of paratyphi, guys, which is sharing a factor number 12, and because of this common sharing of this factor 12 there is cross reactivity, and hence we are only using the O antigen or the somatic antigen of S typhi and not that of paratyphi, guys. Okay, now what exactly happens in Widal test? Okay, for that let's start. Let me explain you this concept. Okay, over here suppose we have a patient over here, okay, and this person is having enteric fever. This person is positive for enteric fever, मतलब इसके बॉडी में Salmonella typhi है, right? If there is a foreign organism or a microorganism or a bacteria entering into your body, will the immune system be keeping quiet? The answer is no, of course not, right? So the immune system of this individual will start to produce antibodies. Okay, will start to produce antibodies against the Salmonella antigen, guys. Okay, for that, okay, now this antibodies, okay, would be present in the serum of the patient, right? And in order to do the Widal test we require various antigens. On the previous slide I mentioned, so यहाँ पे it's a tube agglutination test, yes or no? So we would be requiring test tubes for this. Okay, test, we are going to require some test tubes for this test to take place. So you're going to take several test tubes over here, and we are going to put the antigen, जैसे कि the TO antigen, the TH antigen, the AH antigen and the BH antigen. So basically test tubes में antigen we have taken, then we have to collect the patient serum. So we have to, first of all, of course, we are going to take the blood, and blood से we are going to obtain the serum of the patient. Now this serum, after obtaining, we have to dilute this patient. Okay, this serum is diluted, so there is serial dilution of the serum to be done, and then this diluted serum is then poured into this particular test tube. So what exactly is happening over here? That is, the serum is having the antibody and the test tube is having the antigen. So what is this antibody and antigen reaction का मतलब क्या होता है? That there is going to take place agglutination. Okay, there is going to take place agglutination. Antigen antibody reaction will take place in Widal test. So this is all about the Widal test, and the same procedure is mentioned in the next page in the form of a flow chart. That is, we have to collect the patient serum. serial dilution karna hai, and then it is mixed with the antigens, guys, that I've mentioned in the first page. The TO, TH, AH and the BH antigens we have to take, serially diluted serum, put into inside that. There is something called as the serum is having what? So we have the serum में antibody है and test tube में antigen है. Antibody antigen reaction will take place, and that is what is Widal test. Okay, and of course directly this thing not take place, we have to incubate this thing in a water bath at a temperature of 37 degrees Celsius for 24 hours, and then agglutination is going to take place. Now what is the result of this thing, guys? Very simple. For the result we have to use a concave mirror, guys, okay, because जो भी reaction होगी it will take place at the bottom of the test tubes, right? To observe the bottom very well, we are using a concave mirror, guys. On the next slide I will show an image also of that. So what is the result over here? See, okay, there are two possibilities. Either the serum is going to have the antibodies, or the serum is going to lack the antibodies, right? So suppose I am saying that the antibodies are present, matlab agglutination will take place, right? Agglutination will take place, and that will result into mat formation. And on the other hand, we have your antibodies, okay, if they are absent in the serum, matlab there is no agglutination reaction to be occur, and that will result into a button formation, guys. And this thing is already present over here, that is O antibodies. If I say O antibodies, if they are going to react, okay, with the O antigen, guys, they're going to produce chalky clumps. We know this, okay? Chalky granular clumps would be produced. And if I say that is this H antibodies, they react with the H antigen ke sath react karega, so they are going to produce those cottony woolly clumps, okay? Cottony woolly clumps would be produced. Clear? Now, next thing, let's have a look on some images over here. So here we can see there are various test tubes shown over here for this thing, and see, this is how we are seeing the bottom of the test tube, jahan pe either agglutination reaction will take place. Okay, so here blue color is indication of the TO antibodies, and over here the pink color is for the TH antibodies, guys. Okay, and here there are various test tubes, okay, shown over here showing the titer, okay, showing the antibody titers. Okay, and this brings to the next topic, that is if I say there is a significant titer. Significant titer matlab if the H antibody titer is more than 1:200, it is considered significant, and for the O antibody, if the titer is more than 1:100, it is considered to be significant. Okay, so that was all with respect to the significant titer for Widal test. Then we have interpretation of this thing, guys. Okay, if I'm saying that is agglutination has taken place, okay, against the TO and the TH antibodies, I mean to say that is there is antibodies to the TO or the TH antigens are raised. Okay, if antibodies are raised, so it is an indication of S typhi. पैराटाइफी ए में क्या होने वाला है? सो डेफिनेटली टीओ के टाइटर्स, ओके, टीओ एंटीबॉडीज के टाइटर तो रेज होने वाले, साथ ही साथ एएच एंटीजेंस के, ओके, एएच एंटीबॉडीज के भी टाइटर इज गोइंग टू इंक्रीज. तो डिपेंडिंग अपॉन विच एंटीबॉडी टाइटर्स आर राइजिंग, गाइस, वी कैन कंक्लूड द इन्फेक्शन, राइट? इफ देयर इज एन इंक्रीज इन द टीओ एंड द बीएच एंटीबॉडीज, इट इज इंडिकेशन ऑफ अ सीरोटाइप, ओके, एस टाइफी, एस पैराटाइफी बी का इन्फेक्शन को इंडिकेट करेगा. Okay, so if there is an increment of TO-TH, we can say it is S typhi. If there is an increment of TO and AH antibody titers, it is S paratyphi A. And if there is an increment of TO and BH, it is an indication of S paratyphi B infection, Salmonella paratyphi B infection. अब now Widal test कर रहे हो guys, ठीक है? So there are two, okay, some exceptions also to remember, that is false negative and false positive. What is the meaning of this thing, guys? Let me first explain the meaning of the term false negative and false positive. So see, this term negative, okay, and यहाँ पे जो positive लिखा है, it is with respect to the Widal test. Okay, either the Widal test is negative or the Widal test is positive. Now let me explain you the meaning of false negative. False negative का मतलब होता है that Widal test has turned negative, but this, okay, statement is false. I mean to say that is the person is having enteric fever, but the Widal test is negative. That is what is called false negative. ये कब हो सकता है? Widal test कब करते हैं हम लोग? During the second week we are doing Widal test. So what if I am saying that if I did Widal test on the very early stage, that is within the first week I am doing a Widal test. So see, the person is having enteric fever, but the test is coming out to be negative, right? So that is, this will take place in the first week. Or the person is prior, okay, is on an antimicrobial therapy, उसने antimicrobial start कर दी है, then you are doing a serological testing, then you are doing a Widal test. So of course test negative आने वाले, because antimicrobial start हो चुके हैं, the test will turn out to be negative, right? But the patient is having enteric fever. That is another example of false negative. And last is called as prozone phenomena. Okay, a case where antibody is in excess, guys. ठीक है. अब ये जो prozone phenomena होता है ना, this is a concept in immunology, guys. In okay, where immunology में जब हम लोग antigen antibody reaction study करेंगे ना, so there is a prozone phenomena, then the zone of equivalence or something. It is a part of your, I guess, the Marek's lattice hypothesis. Okay, Marek's lattice hypothesis का part होता है ये. If suppose उसके according to this hypothesis it states that the antigen and the antibody will react only when the antigen and antibody are present at okay appropriate proportions में जब present होंगे तभी reaction will take place. So if I am saying that is if the antibodies are in excess, guys, do you expect any agglutination to take place despite the presence of antigen? No. So that is another example for false negative. So in all these three cases, the person is having enteric fever, but the Widal test is coming negative. And the exact opposite is false positive, guys. Over here, matlab the test is turning out to be positive, but this is false. I mean to say the person is not having enteric fever. So in this case, the person is not having enteric fever, is not present. And for false negative here, okay, all the patient is having enteric fever है, लेकिन test negative है, guys. Therefore, it is false negative. And here it is false positive का मतलब क्या है that the test is positive but the patient is not having enteric fever, and this is seen in persons okay who have been vaccinated, guys. Okay, prior immunization with the TAB vaccine, okay, with the TAB vaccine के साथ अगर immunized है तो ऐसे केस में definitely Widal test will come positive. तो immunization का मतलब थोड़ी ना the person is having infection, right? The person is having the disease, no, right? The person is not having the disease, again test positive आ रहा है, that is false positive. And another case over here is anamnestic response. What is anamnestic response? It's a bit complex to understand, but let me try. ठीक है, anamnestic response में क्या होता है? The person definitely, as I said, is not having enteric fever. तो ऐसे मतलब क्या होता है? This particular a person who had enteric fever in the past. So enteric fever in the past. Okay, enteric fever in the past उसको मतलब बहुत पहले enteric fever हुआ था. And currently, okay, currently the person is having some other infection, जैसे कि मलेरिया है और डेंगी, एनी वन ऑफ द इन्फेक्शन, करंटली ही इज हैविंग अनदर इन्फेक्शन. ठीक है, तो जब पास में एंट्रिक फीवर हुआ था तो एंट्रिक फीवर के वजह से द इम्यून सिस्टम हैज जनरेटेड सम एंटीबॉडीज, राइट? एंड वी नो द रोल ऑफ मेमोरी टी सेल्स, गाइस. ठीक है, तो एंटीबॉडीज हैज बीन जनरेटेड एंड दे स्टे फॉर अ लॉन्गर ड्यूरेशन. वी नो दिस थिंग दैट ओके व्हाई दिस थिंग हैपेंस, बिकॉज जब सेकेंड टाइम अगर एंट्रिक फीवर का इन्फेक्शन होता है बॉडी में, so the body will quickly take an action against it. That is what is called anamnestic response, right? But right now what is happening over here, that is enteric fever past में हुआ था, उसके वजह से antibodies generate हुई है उसके body में, and currently he is having some another infection, जैसे मलेरिया है, डेंगी है, and the suppose the physician or the doctor has okay ordered a Widal test, एक Widal test करवा लो safe side के लिए. ठीक है, patient did a Widal test came out positive, guys. ठीक है, but later on we get to know that मलेरिया या डेंगू कोई और केस है, but Widal test पॉजिटिव आ रहा है. क्यों आएगा पॉजिटिव? इट इज बिकॉज ऑफ दिस एंटीबॉडीज जो उसके फर्स्ट इन्फेक्शन में, जब पहली बार उसको एंट्रिक फीवर उसके पास में जब हुआ था ना, तो जब उसके अगेंस्ट जब एंटीबॉडीज जनरेट हुई थी ना, दोज आर द वन. ठीक है, तो मतलब लाइक जब सेकेंड टाइम मलेरिया या डेंगू या कोई भी अदर इन्फेक्शन होता है तो बॉडी का इम्यून सिस्टम बहुत फटाफट तो उसके अगेंस्ट एक्ट करता है, राइट? बिकॉज ऑफ दैट दिस थिंग इज हैपनिंग. बट अगर एक तो मतलब ये फर्स्ट वीक के अंदर की बात कर रहा हूँ, विद इन द फर्स्ट वीक अगर आप लोगों को बहुत ज्यादा हाई टाइटर देखने मिलते हैं, विडाल टेस्ट इज कमिंग पॉजिटिव, देन मोस्ट लाइकली इट इज सम अदर इन्फेक्शन, इट इज नॉट एंट्रिक फीवर. बिकॉज एंट्रिक फीवर के अंदर गाइस फॉर द विडाल टेस्ट टू शो ओके पॉजिटिविटी एटलीस्ट 1 वीक के बाद, दैट इज बाय सेकेंड वीक विडाल टेस्ट विल शो पॉजिटिविटी, है ना? 1 वीक के बाद आफ्टर द फर्स्ट वीक द एंटीबॉडी टाइटर्स आर गोइंग टू रेज बाय 4-fold, गाइस. ठीक है, so that was all with respect to the false negative and false positive and Widal test. So that was all with respect to Widal test, okay, by my side, and that was all okay for this session. Thank you so much for watching. If you found this content useful, then do like, share and subscribe to the channel, that is the AMS MBBS lectures. If you have any questions or queries, do comment down and let me know how you found this session. See you on the next one. Bye bye.